Well, I want to welcome everyone tonight to our educational program, Men's Pelvic Health After a Cancer Diagnosis, with Matthew Johnston. And Matthew is a Philadelphia area native and recent transplant to the DMV. He has developed a specialty in men's health physical therapy, which includes pelvic health issues. He has advanced training in treating pelvic health conditions, including bowel and bladder symptoms, orthopedic sports related groin pain, sexual health concerns, pre and post cancer treatment side effects, and orthopedic issues unique to men. He also has a special interest in the treatment of pelvic and genital pain conditions. Matthew has been involved with course development for training of other pelvic health therapists and works to advance the field of men's pelvic health in the physical therapy community. He graduated from Temple University from an accelerated degree program in kinesiology and with a Doctor of Physical Therapy. He also has a board certification in orthopedic physical therapy. And Matthew, we're so happy that you're here with us tonight, and I'm going to turn it over to you.
Great, thank you. I'm super excited to be here. Thank you to Stephanie and Hope Connections for having me. And tonight I'm really going to be talking about the nuts and bolts of men's pelvic health after a cancer diagnosis. Again, my name is Matt Johnston. I work at SET Physical Therapy here in Washington, D.C., and I am excited to teach you guys a little bit more about pelvic health. So our roadmap for tonight, we are going to be talking about what pelvic health is. We're going to be talking about some oncology topics, so side effects, treatment options, things that may impact the pelvic area. And then we'll be talking about the physical therapy side of things, what treatments that we can offer, and then the kind of general team approach and some resources. So we have a kind of a full program for you guys tonight, and looking forward to kind of taking one step at a time on this roadmap. So before we get into things, I wanted to kind of make a couple disclaimers. First and foremost, tonight is not just about prostate cancer. Men with all types of cancer can have impacts to the pelvic region, even in cancers that don't affect primarily the pelvis. So things that are far away from the pelvis can also have implications and side effects to the pelvic area. Some common treatments can also have side effects to the pelvic area. So I think that's a really important topic for tonight. Tonight's not just about prostate cancer. I know that gets a lot of the media craze, and the education programming is really often around prostate cancer, but tonight's going to be a little bit more than that. And really another soapbox for me is about asking questions to patients, to other PTs, to physicians. If questions aren't asked, then we're really missing the whole picture. So I encourage you guys to ask questions. If I don't know it, I will help find the answer for you. But also encourage you to ask questions to your other providers, to other resources that you guys have in this oncology world. The symptoms that aren't talked about aren't found solutions for. So the more we talk about things, the better. And just because something's expected, like a side effect of treatment, doesn't mean it has to be untreated, right? So there's options for a lot of these symptoms that maybe people don't talk about or really know that they're problems. So I'm hoping to give you guys some information about some of these symptoms, and then maybe that will help kind of lead you on a path to getting some options for treatment. Finally, consulting your medical team and or oncology or pelvic health physical therapist prior to doing any sort of exercise or new workout routines is really important. So make sure you're just getting some medical clearance if that is important to you guys. All right, so our first stop is, do men have pelvic floors? And the answer to this question is yes. Everyone has a pelvic floor. I know in the medical world, a lot of the times men aren't thought to have pelvic floors, but we do. And they can be areas of problems, areas of symptoms, and especially when we're talking about the oncology population, there can be definitely cancer that affects this area, but also treatment side effects that can affect this area. So men do have pelvic floors. We're going to talk a little bit about what they do, where they are, and how they kind of fit into this oncology picture next. So the pelvic floor, so on the picture here, we can see the bones of the pelvis. We can see the bones of the lower spine and the bones of the hip. In the center there, and we'll take a look at these muscles in a second, but in the center there is where the pelvic muscles will be. And they provide a lot of different roles. So the main 5 roles is that they are sphincteric. So they keep things in when they're supposed to be in, like stool or urine, and then they relax for the times when we want that stool or urine to come out. So they keep things in when they're supposed to be in. They play a support role for organs, so like our prostate, our rectum, the organs of the intestines and stomach. All of the pelvic floor muscles kind of help hold those organs in place and support them kind of from the bottom up. The pelvic floor muscles play a role in sexual health with ejaculation, orgasm, erection. So our sexual functioning is really determined by these muscles, among other things like our blood flow, our nervous system health, etc. The pelvic floor plays a role in stability, just like the muscles around our trunk, our abdomen, like our core muscles, our hips. These muscles all play a role in stability. So, for example, the pelvic floor is relaxed when you're laying down. It starts to contract a little bit more when you're sitting. It contracts even more when you're standing. So it really helps play a role in like posture, stability, um, and exercise. You know, if we're standing on one leg, that's a lot more work for the pelvic floor than standing on 2 legs. And finally, the pelvic floor has a role in what's called the sump pump of the body. When we breathe, our diaphragm and our pelvic floor work together, just like a piston in a car or a sump pump, to pump fluid throughout the body, like blood, lymphatic fluid, which we'll talk about later on. So, really important role. If we have swelling in the legs or if we have breathing issues, that can all affect the pelvic floor as well. So this is one of those other things that when we're talking about men and cancer, we're talking about sleep apnea, we're talking about breathing, we're talking about cancers that maybe affect the head and neck. Those can all have a role in affecting the pelvic floor because of this sump pump and breathing mechanism. Here are the pictures of what the pelvic floor really looks like, the muscles. When people talk about the pelvic floor, usually they're talking about muscles, and here they are. So if we're going to start at the picture to the left, we can see a split down the body. So this is dividing the body in left and right. In the center there, we can see the bladder. That's going to funnel down into the urethra. That's the tube that goes out of the penis for urine. And through that goes the prostate. So the urethra goes through that prostate. To the right of that, we have that long kind of like sausage looking thing. That's our colon and rectum. And we can also see the tailbone and back of the pelvis kind of to the far of that picture. So we can kind of see how closely related the bladder, the prostate, the colon and rectum are all kind of just like in relationship to each other. You can see the testicles outlined there as well. So there's just a lot of closeness in this area. So one treatment area might affect some of the other parts. We see this sometimes in radiation treatment where someone's getting radiation to the prostate or the bladder and they have side effects to their bowels there. The picture that's kind of towards the bottom in the center, we're in the stomach area and we're looking down to the pelvic floor. Towards the back of that brown area, that's the bones of our back and pelvis. And towards the front, that would be like where our belt buckle is. So all of these muscles play a big role in support. They look kind of like a trampoline or a hammock, and their job is to do all of those 5 things as mentioned before. But really, when the pelvic floor muscles contract, they kind of lift up towards the belly, and when they relax towards the floor. You can see in this picture specifically, there's a white hole in the center, and that is for stool to go out. There's a similar hole towards the front. Not quite easily seen here, but you can see a smaller hole, and that's where urine comes out. So again, that sphincteric role of keeping stuff in when it's supposed to be in comes from those muscles. Towards the top right, we are looking outside of the body up towards the pelvic floor. So if this person was laying on their back, you can see kind of the big muscles of the glutes and the tailbone towards the bottom, and then the genitals towards the front, the top. These are all those muscles are all making up the pelvic floor, but also we have relationships to those hip muscles. So those muscles towards the bottom are our glute muscles. They are in our backside, and they make up our hip muscles. So they help kind of have this synergistic role with our pelvic floor. So when we talk about orthopedic things, bone cancers, we can see that there's some relationships to these muscles. We can see the anal sphincter. We can see the base of the penis and some of the supporting muscles of the penis towards the top of the picture. So our next question is really talking about what's happening to my body. We're going to talk about some of the common symptoms, the common types of cancers that particularly maybe impact men, and then what they do in terms of um, impacting the pelvic floor specifically. So some of our common cancers, obviously prostate, that is probably the most commonly associated cancer related to men, but men can also experience bladder cancer, testicular cancer, colorectal cancer, and orthopedic cancers. So things that affect the bones of the pelvis, the spine, the hips. Um, Sometimes we even see things that affect the head and the neck, the rib cage, the lungs, can also have a relationship to the pelvic floor. Usually those are more indirect relationships, but the ones listed here are certainly around that pelvis area. Um, we can see that most of the time pelvic floor therapists or pelvic therapists are going to see prostate cancer care, but that's changing. The field is really evolving. People are reaching out and working with men and women with all sorts of cancer diagnoses. Um, and there's this kind of growing um, relationship with not only providers but with patients, and helping them through a cancer treatment process or their long-term like survivorship role. So we're here to help. We're here to help answer questions, improve your understanding about what's going on with your own body, but also getting you back to the things that you like to do. Um, some common treatment options that people will experience: surgery, radiation, chemotherapy, proton therapy, which is common in prostate cancer, active surveillance, which is commonly prescribed in prostate cancer, and that there's things that happen in all of these treatment options that can be influential to the pelvic floor, but options that are maybe even directed somewhere else that can impact the pelvic floor, right? Um, there's more and more treatment options coming out. New things are getting developed all the time. And there can be really a wide spectrum of treatment side effects. Some people who get prostate cancer surgery have very little side effects. Others have a lot of side effects. So how can we help navigate the journey with each of those individuals? Because they're going to look very, very different. So the impact on those folks can be very different. There's also a lot of value on what we call prehab or pre-rehabilitation. When patients are coming before their new onset of their diagnosis or before treatment, in that active surveillance phase specifically, in some of the other cancer demographics, maybe where they're coming before surgery or before radiation treatment to help kind of clean up some of their bowel or bladder habits, or helping them move, get a little stronger before treatment. Um, we see that a lot in the oncology physical therapy population, but we're now seeing it a little bit more often in the pelvic area, the pelvic floor specialty. Most often, we see this in the prostate cancer department. A lot of the times, those folks will come pre-surgery or pre-treatment, and then we'll see them after treatment as well. But I think it's becoming more popular in the other cancer demographics as well, and hopefully we'll see that continue to grow because I think it's really valuable. Um, so our treatment impacts, and we're going to kind of dive down into each of these, but generally we're looking at treatment impacts for our bowel health, for our bladder, for sexual function, for pain, and for movement. So I kind of classified them in each of these categories, and we're going to really talk about each of them. The impact of treatment can really go beyond the pelvis. So we see things that, someone has a bony cancer in the pelvis, and that affects not only that area feeling stiff or painful or otherwise, but we're also seeing it affect their walking, their breathing, their how they stand, walk, their movement in general. So there's really things that go beyond the pelvis. Today we're really going to talk about the pelvis stuff, but um, sometimes we have to think big when we're looking at these cancer conditions. So, in the bowel department, we can see a variety of things, and you'll start to see some similarities between bowel and bladder, but I listed them separately because there's a couple nuances here. So, in the bowel department, we can see everything from diarrhea to constipation to getting really, really strong urges. So, all of a sudden, you're sitting at the couch at home and you get a really strong urge to go to the bathroom, and maybe you don't make it in time, right? Maybe there's some leakage involved. Um, Maybe you're going too often. You're having 5 or 6 or 7 bowel movements a day. Um, you feel maybe bloated or sluggish. You feel heavy in the abdomen section because you're not getting that stool out efficiently. You're not emptying your stool efficiently. Sometimes there can be pain with bowel movements. So we can see a really wide variety of stuff. A lot of these you'll see happen after colorectal cancer surgery. Radiation is a very big culprit in this department. Um, Radiation for prostate cancer or bony cancer, in the pelvis in general. That maybe some of those radiation beams go through the rectum and colon, or maybe they get absorbed there, depending on their angle. Some of this is changing a little bit. Some spacers and stuff are making it a little bit less problematic after prostate cancer specifically, but we do see a lot of bowel symptoms, and again, like, not something to be embarrassed about. Something that's a very real concern, and that has some real solutions. So there's definitely relatively easy things to get started with when we're talking about these bowel symptoms, so that we can either make you go a little bit more often if you're on the constipation side, help you kind of bulk up your stool and make it go a little less often if you're on the diarrhea side. Maybe get a little bit more awareness on controlling your urges, or getting things to empty efficiently so you don't feel that like bloating or sluggish feeling. So bowel symptoms can again have this wide spectrum of side effects or results, and there's some easy treatment options that we can address there. For our bladder department, we will see very similar symptoms. So going too often, or really, really strong urges, urine leakage. That's probably the classic thing that people will talk about for prostate cancer surgery, prostatectomies. They'll have urine leakage afterwards. So retention is the holding in of urine. Your body's getting a strong urge, or maybe bladder's filling. You get to the toilet and you just can't go. Your bladder won't contract, or your pelvic floor won't relax. Sometimes there's some more medical issues that are going on there related to the nervous system, or the bladder. But once those are cleared and people again are having some trouble emptying, maybe that's a time and a place for physical therapy to help. Sometimes we'll see changes in stream, like a weak stream or split stream. It will spray, which is messy and kind of bothersome for a lot of folks. So we can see stream changes. Sometimes we'll see bladder pain, so pain at the kind of lower belly area where your belt buckle would be, pain with emptying or stiffness feeling. So there can be some of those sensations happening when we're talking about bladder symptoms. Some of these can happen with bladder cancer, obviously prostate cancer, but sometimes they can happen again with the radiation side effects that are being absorbed into the pelvis. The pelvic floor muscles will stiffen up and we'll talk a little bit more in depth about radiation, but sometimes that affects how people empty their bladders or empty their bowels. So now we're going to talk about sexual function. This can be a wide variety of things, and this is probably the biggest area people aren't talking about. With their partners, with their family, with their providers, with their physical therapy team. This is the area that people don't feel comfortable with it. And there's also probably the least amount of resources related to this. So hopefully that's changing. That is changing. We're seeing more and more. I have some resources at the end of the presentation for you for you guys to kind of peruse. But sexual function problems can look like erectile dysfunction, the inability to get or maintain an erection. Peyronie's disease is a bend or a curvature after during erection, and that can typically happen after prostate cancer. There's like a 10% chance that might happen. So again, it's something to be aware of, right? If you're not getting erections because you just had surgery, and later down the road you notice something that's irregular, there's a curve or like an hourglassing or a dent. Um, that might be something that you didn't know that was abnormal, and something to maybe talk to your doctor about. But there's treatment options for those things. Sometimes erections can be painful or feel really stiff or like tight. There can be changes in ejaculation or orgasm, like the inability to ejaculate. Sensation changes, like the orgasm is not as strong or it's too strong. Um, there can be some changes in penile length, so like shortening, especially after prostatectomy. And there can be something called climacturia or leakage during climax or ejaculation, orgasm. So there's a lot of different sexual side effects. There are things called neglected sexual side effects, and those are the things listed here. The things that are not being talked about, they're being neglected. Um, in the oncology population, almost 40% of patients, this is independent of like prostate cancer, but this is across the board for all oncology patients. Almost 40% of those patients will experience erectile dysfunction. Um, there was really clear impacts from treatments, because before treatment, only 28% had erectile dysfunction, and it jumped to 42% following treatment. So we see this kind of big increase after a cancer treatment or oncology treatment. And that's multifactorial, right? There's financial strain, there's relationship strain, there's mental health strain, there's a lot of things going on, and all of those things can sometimes impact our erectile function. Um, in a really big study with like over 100,000 patients, so lots and lots of patients, there was a variety of symptoms that people experienced. So bladder cancer survivors experienced dry orgasms, or they weren't able to ejaculate. There's no ejaculate fluid. Prostate cancer patients had the highest erectile dysfunction prevalence at almost 58%, so really high in that population. But there was other things that they saw, which was really interesting, like lymphoma survivors identified fatigue as a predominant cause of their sexual inactivity at 81%, so a huge number of those folks. And this even affected younger patients too. So 58% of young or middle-aged cancer patient reported erectile dysfunction to some degree. Um, there was a very interesting finding too. I'd like to share this one because there was a cohort of patients who had liver cancer. They're male patients with a type of liver cancer that actually saw an improvement, and that had something to do with their um, testosterone and their cardiovascular status post treatment. So it was really interesting. A lot of these things are still unknown. Like there's not a lot of research coming about the sexual side effects of cancer care. Um, Interestingly, I guess fortunate in this population, there was really no clear link between testicular cancer and erectile dysfunction, which is good. So we're seeing things across multiple different cancer types, not just affecting the pelvis, but all throughout the body, but affecting the pelvic health and the sexual health of men. So really something to be aware of, starting conversations with your providers, starting conversations with your partners. There's definitely team members that could be helpful in this department to start the conversation and provide some options for treatment to improve and trying to get things functioning that in a way that maybe is better than where you're starting now. In the pain department, this can be wide ranging as well. Some of these things are specific to the pelvis, like genital pain, pelvic pain, abdominal pain, orthopedic symptoms, maybe outside of the pelvis, like spine or hips, the rib cage, the tailbone, at the rectum. And sometimes this can also, I lumped in like change in sensation. So numbness or tingling, like less sensation or less feeling, or heightened sensation, something that's hypersensitive or too sensitive. And pain can Pain we can see from like surgical incisions. We can see it from stiffening of tissue because of swelling. We can see it from radiation that stiffens the tissue. Um, so there's a lot of things that can cause pain problems, but it's a symptom that affects not only the sensation, right, like the presence of pain, but also the your sexual function, right? Like erectile function, sexual activity does not occur very well in the presence of pain. And finally, we're going to talk about movement, right? Um, Not only are there general side effects of cancer treatment, like um, fatigue, swelling, um, sluggishness, stiffness places, but there's things that can affect the pelvic area itself, like stiffness or weakness, loss of motion, difficulty doing things because the pelvic area is affected, like walking or squatting. Sometimes we also often see this in the hip area, but we can see this also in like the ability to get stool out. Right, if those muscles are really stiff, it's hard to get that stool out. Maybe it'll be like really small, like pencil thin, and that's a problem as well. So now we're really going to talk about the main treatment options for folks, and what physical therapy can help with, and how we can maybe give you some kind of thoughts or guidance if you have not tried any of these things. So active surveillance. A lot of the time, people say, "Well, nothing's happened yet," but this is a really great option for getting some treatment, not only from an exercise but an educational perspective. Um, there's a ton of research about active surveillance and exercise, um, and there's the good news is that many many different exercise programs can help. They can be aerobic, they can be strength training, high intensity interval training, walking programs. There was a lot of research that talks about how that changes not only your weight, your endurance, your cardiovascular status, but also like some indicators for cancer changes as well. So, um, your A1C and your sugar levels are better. So like this is a really prime place, if anyone's on active surveillance, to start an exercise program or enhance the one that they're on, and really kind of grow their body's like resiliency before any next step is taken. Right? If the option is to get surgery or to get radiation, right, the better and more mobile, the strong, more robust your body is going in, the better it's going to be going out, and that can be really exciting. This is also a great time to work on understanding what the pelvic floor is, how to contract it, how to relax it, how to optimize your bowel and bladder habits. Um, if you're constipated before you get your prostate cancer surgery, well, that's going to have really big impacts on your leakage afterwards. So, the active surveillance stage is a really great time to clean up stuff, to work on things, to really set a good foundation if and when another step happens. And if there's no other step happens, you're going to be feeling better, you're going to be moving better, you're going to have more optimal bowel movement health in general, and that's a really good thing for how you feel. I lumped pelvic radiation and I lumped proton therapy together because they're somewhat similar. Um, pelvic radiation is the gift that keeps on giving. Sometimes symptoms can happen later on. Sometimes symptoms can happen at the time of radiation. Usually at the time, people feel like a little fatigued or a little crummy. They'll have maybe some discomfort places sometimes. But later on, some of those pelvic floor muscles and tissues, the tendons, the ligaments, can really start to stiffen up, and that can impact your bowel and bladder health. Usually, we see that in relation to like leakage of urine or stool, constipation, urgency, going too often, f- um, difficulty emptying bowel or bladder. So, working on some mobility or flexibility of the pelvic floor or the hips can really be a good option. Um, this is probably the lesser developed research in the pelvic health world. We know a lot about um, prostate cancer incontinence, for example, or leakage of urine after prostate cancer, but we're still learning about radiation. A lot of the things that I will teach patients with is similar to the active surveillance. We're talking about optimizing those bowel and bladder habits before radiation, if that's possible, or early on in the process before things start to stiffen up, and create a good flexibility and mobility program for them to like carry on with them. Some of the other research talks about aerobic exercise, resistance training, um, and starting to get those treatment options on board. So again, trying to get them to improve their cancer-related fatigue after radiation moving forward. This is a tangent slide on lymphedema because in my opinion, is the missing link in men's cancer health. Very few people are talking about it. I am just jumping on the train in the last year. It's something that I didn't historically ask patients about unless they offered it up. But lymphedema really is a problem. Um, lymphedema therapists don't want to talk or touch about genitals. Pelvic health therapists don't know much about lymphedema. So there's this big problem where patients are not getting help that they need, and they're experiencing these lymphatic conditions. So lymphedema is like swelling in a body area. So you can see on this picture, the picture labeled A on the left. We can just see um, a small amount of lymphedema places, especially around the genitals. Um, Very localized, small amount. But on the right, we can see pretty severe lymphedema in that leg where it's kind of brighter towards the shin area, like towards the bottom, and around the scrotum, especially. So this is if impacting people. Most often we see this after prostatectomy surgery. Sometimes we'll see this after other types of surgery or radiation, especially if lymph nodes were dissected or removed. But the most frequent complications of surgery or radiotherapy or radiation is in like the lower limbs, the groin, the genital area. We can also see like joint stiffness, changes in like skin tone or pigmentation, difference in sensitivity. Limbs can feel heavy. There's an increased risk of infection in this area. So huge, huge, huge problem, and something that's not really being talked about. So I like to highlight them in these presentations because it's something I'm learning about. It's something that I think as a whole, the pelvic health community is learning about. And it can really affect a huge amount of patients. If you have a lymph node dissection, it's like 15%. If that lymph node is just radiated, it's maybe around 8%. If you get the combination, it can be as high as 30% of patients. So it affects a pretty big amount of patients, up to 15 to 30% is not a small number, given the fact that how high, the high amount of patients getting prostate cancer. This is in the prostate cancer population, but there's definitely relationships to other cancers that maybe get lymph nodes removed or radiation to this pelvic area. Next, we're going to be talking about hormone replacement therapy. Again, commonly seen in the prostate cancer, but can affect other patients as well. A lot of the times we see fatigue, we see cardiovascular complications, we see mood changes and weight changes, muscle mass changes. So exercise during this time is crucial. Again, one of those things where we see some pelvic symptoms in especially the sexual health department, less so in the bowel and bladder department. But the opportunity for aerobic exercise or resistance training to combat some of those muscle mass changes is very important. The more your body is moving well, the better your pelvic health is going to be moving. Um, you know, the more your body is getting exposed to like full ranges of motion, aerobic exercises, things that make you sweat, breathe heavy, the better your bowel movements are going to happen as well. So, this is a huge thing in this hormone replacement therapy treatment option is that, the more we get you moving, the better. Uh, Finally, we see surgery. This can be anything from changes in your range of motion, changes in your movement, like walking, stiffness. Sometimes the scar hurts or it pulls on things. Surgery can be on the orthopedic side. It can also be on the prostate, the testicle area. So there can be a really wide variety of surgical options. Um, Again, this is a great opportunity to experience physical therapy prior to surgery, even from an educational perspective of what's going to happen to your body, ways to manage things, and then kind of launch you into surgery, feeling and moving well, and then post-op, helping with the recovery. I thought this was a really interesting study I just came across, that men with testicular cancer want to know more. This study looked at online discussions happening on a website called Reddit, which is like a forum type website, and the study really talked about the unmet emotional support needs in clinical settings. So with physicians and physical therapists and psychologists, that men with pelvic health or men with testicular cancer, excuse me, weren't talking about their pelvic health, their sexual health especially. So it really highlighted the potential barriers to discussing sexual health, importance of their peer support resources, um, and it analyzed the data and said that only 10% of the time were people talking about sexual health. So I thought that was really interesting. It really just kind of drove the point home that like this problem affects everyone. These pelvic problems affect um, you know all sorts of different patients from different ages, different body types, different cancer types, different walks of life, financial situations, occupations. These cancer side effects do not discriminate on any of those factors, and there can be really, again, I don't say easy situations or solutions, but there are solutions that can help patients feel and move better. Um, so the next thing we're going to talk about, the next stop in our roadmap, is what does PT have to do with cancer? Or what does pelvic PT have to do with cancer? Because I think the subset of oncology patients who are getting offered physical therapy is very probably low, but the patients that are getting offered pelvic health therapy is probably even lower. And there's things that again we can do to help through the journey here. So pelvic floor specific treatment is specific to the person. It's going to depend on everything from which type of cancer, your goals, your fitness level, your health status, what other conditions you might have, um, and what you're really looking to work on, right? So it's specific to you, it's individualized to you, and it can include any of the following things. So exercise, so like general exercise things like strengthening, aerobic exercise, walking programs. It can include specific exercises to the pelvic area. So trying to get those pelvic floor muscles to expand for better bowel movements, to tighten up or strengthen them for better incontinence control, like after a prostatectomy. Um, Working on stiffness, like from a hands-on perspective. Um, if I had shoulder surgery and my muscles and joints, ligaments are all stiff because I was maybe put in a sling for 6 weeks, 8 weeks after surgery, well, I'm going to need some hands-on stuff to get that shoulder moving. Often we see this in like breast cancer patients who maybe get radiation to the shoulder area. That shoulder becomes really stiff. Well, those things are happening in the pelvis. The hips are getting stiff, the pelvic floor is getting stiff, and sometimes we need some hands-on treatment to help kind of speed that along. A lot of what we do is education, teaching you about your body, what's going on, what happened to the particular body area after the procedure, after the radiation treatment, that you have a pelvic floor in general, but also like what does this area do and how we can help kind of optimize it so that you can again move and feel better. Um, we talk a lot about bowel and bladder retraining. We talk about how to get those things moving in the right direction in terms of like how often, leakage, all the symptoms before, but we try to retrain those body parts in the bowel and the bladder to work the way that they quote unquote should work, right? If you have a bladder that's not storing any fluid after your prostatectomy and everything's leaking out, well, how do we get that bladder to learn how to store again and then empty when it's supposed to? That's a really big important factor in the colorectal department. How do we get the anus and the rectum to store stool and not leak out? And how do we retrain that process so you can go when it's convenient for you to go? And then finally, I put here options for sexual function. Sexual function is a team sport. It requires a lot of different folks to kind of get on board, and we'll talk about who those people are. Physical therapy is an important piece of that because we need to have strong muscles, mobile or flexible muscles, and good kind of nerve and body health for good sexual function. But it's not just done in isolation. There's other people on board that can um, help kind of optimize that piece. Um, you know, kind of as we wrap up here, your journey is unique. There's so many things that affect people with a cancer diagnosis, like finances, time, how intense their treatment was, right? Someone had a really long, intense bout of chemotherapy. Well, that's hugely intense. What your exercise history was before, what your goals are, what you want to get back to. So the journey is unique, and physical therapy does not is not a one size fits all. Some people just want to learn with resources on their own. Some people want a couple visits with just some education and some consultation to get them moving in the right direction. Other people want a really deep dive and they want step by step guidance and they want that kind of soup to nuts experience where we're helping them before, during, after. And I think that's a really big barrier to a lot of patients is that they think it's going to be 3 times a week for 8 weeks or longer, and that's just too big of a commitment at that time. And it doesn't have to be that way. My goal really in talking to you guys and helping kind of highlight some resources here is really so that you know that this is a problem and there's some easy solutions and that it doesn't always have to look like a ton of visits. And we can kind of tailor it to what you need. So, exercise and cancer, there's a variety of options, lots of different things: aerobic, resistance, walking programs, flexibility. Um, 150 minutes of exercise per week is really the gold standard, and that's something that we try to highlight with everyone that walks through the door with the cancer concern. So that really is something that I try to work on ramping people up to. I wanted to zoom out as well and talk about general health. Pelvic health has relationships with bigger picture of men's health in general. Um, Men are higher risk for cardiovascular problems like COVID, heart disease, heart attacks, and that those things are directly related to erectile function. So there's these overlapping problems in not only the pelvic health but also big picture. Unfortunately, men have more difficulty seeking mental health than women. They're more likely to take their own lives than women, especially in the Western countries, here in the United States. Um, and that's a big problem. That I think sometimes gets magnified when we're talking about oncology issues or other kind of specialty issues that people aren't willing or wanting to talk about that are intimate like the pelvic area. So it's really why I bring this up because I want people to have resources to go to or people to ask questions to. Who else can help my symptoms? Who else can be part of the team to help? And that team can look like a pelvic health PT, your oncology physician, like a specific to your diagnosis, like a urologist, colorectal, orthopedic, your primary care physician, a mental health practitioner. There's also someone called a sex therapist. They are mental health practitioners that are specific for sexual functioning problems. So, folks who get a prostatectomy and their sexual identity or life has changed because of erection changes, that can be someone who can help walk you through that process. They can also talk through the concerns that people have after going through a cancer diagnosis and journey related to stress, anxiety, depression, and how to return to sexual activity feeling confident and healthy. So that's another kind of like unspoken part of the team that people I don't think really realize that's available. A lot of people know, how can I find a PT? If I don't live in DC, or if I, you know, want to stay in my neighborhood or in my network, how can I find a PT? Well, the APTA, the American Physical Therapy Association, has a pelvic health directory. There's a directory in what's called Herman and Wallace. They're an education company. Sometimes just searching the internet for pelvic health PTs or oncology PTs can be helpful, especially if you're looking for in your own neighborhood. Um, Big questions to ask is, how many male patients do you see, or how often do you see a male patient? Which conditions? Did you have any special training? Are you comfortable examining the area that I need examined? If I have colorectal cancer and someone's not maybe looking at the anus or seeing those muscles contract, if they're not comfortable with that, maybe that is not a good fit. Um, if I need,
Pelvic,
if I need a scar looked at,
go ahead.
that also can be a piece of the puzzle too. So asking those questions up front can be very helpful. Um, some other resources. So resources that are educational in nature. A lot of them are podcasts. They are talking about men's health in general. They're talking about urology concepts. The Penis Project is great because it interviews men with a variety of primarily prostate cancer, but there's other cancers um, involved in that project that is really interesting to see their story. The It Takes Balls podcast is also really testicular cancer. So there's a variety of other resources out there, if people want to learn more about pelvic health. And finally, I talk about where should I start. Um, Usually it's about learning, right? Learn about your body, learn what these muscles do, learn about um, how your symptoms might be impacting your goals. Um, Start moving and then optimize, right? How can I get a better bowel movement? Does that affect my running technique, or does that affect my ability to sit and watch TV? Or if I have to get up in the middle of the night 5 times to go to the bathroom, or I'm leaking through my pants or pad, um, that is a problem. So start small. I'm here to answer questions, but start small, move more, and then we can optimize that kind of through those two things. And my final question is, what questions do you guys have? I put my email here at the bottom if you guys need things beyond today, but I'm interested to hear what you guys have questions about and learn more from you.
Well, Matt, thank you so much. This is so informative, and I love all the resources that you shared. And now I'm going to stop the recording